Great. Okay, here we go. Little technical difficulties. Facebook Live, Dr. Rob here. We're going to talk about when to see a chiropractor. So many of my patients have asked me, and so many doctors are looking to convey that message for people to come to see chiropractors. Only 14.2% of the population sees chiropractors, and that is mystifying to me. There's so many good chiropractors can do things they can do to help you. Let's just start with lower back pain. The first thing you would just see a chiropractor for would be lower back pain. 8 out of 10 Americans have lower back pain. It is without question $100 billion cost to our healthcare system. So chiropractors, without question, we are specialized. And if anything, we should be primary care for lower back pain. Now, when I say lower back pain, pain in this area right here, I got my spine Romeo here, and we specialize not in just the alignment of the joints, but the assessment of what's going on. So you can come to a chiropractor, we have doctoral rights, we can give a diagnosis, we can give an assessment, and we can also give a treatment. And that treatment can usually be provided in most chiropractic offices on the first day. Again, 8 out of 10 Americans have lower back pain. So many people specialize in lower back. So what are some of the treatments that I do in my office that are unique with the chiropractic genre? Number one, we do spinal manipulation. Study just came out that they found out that spinal manipulation is the leader. There have been multiple studies, but just one just a couple of days ago that it increased your outcome over everything else you could do by 16%, or in addition to everything else. So spinal manipulation for the lumbar spine is without question a great choice. Soft tissue technique, so what I like to refer to as myofascial release, active release. That's the one I use in my office. It's a soft tissue technique that we use to break up muscle adhesions, those tight muscles. You know, where people say, oh, they're spastic? Oh my God. Well, maybe I'll go to a massage therapist. Love my massage therapist, all really good. However, if they're not using a technique like an active release or a myofascial release pointed at giving you proper balance in your lumbar or pelvic area, then you're not going to get the same outcome you would as if you come to a chiropractor. I also like things like instrument-assisted soft tissue mobilization, like Factor. Factor is a great choice. It's a tool that's used to break up fascial adhesions and also to break up scar tissue to help you realign any kind of injured structure. So chiropractors are hands-on, and then hands-on with instruments and modalities. There's modalities out there that can really help patients. My number one modality is without question low-level laser. Low-level laser has FDA clearances throughout the body. The Arconia laser is the one I use, like everybody knows, but low-level laser sends a non-scattered, coherent light, same wavelength as visible light, gets absorbed by the body, and starts a healing cascade. Oxygenation, neurotransmission, and the big one is ATP. So I use a lot of laser in my office to help people get over multiple musculoskeletal injuries, but especially lower back injuries. In addition, core strengthening. Man, we should just do a Facebook Live on core. I was just teaching a seminar on Sunday, and one of the attendees had chronic lower back pain. Chronic. Tried multiple chiropractors, and I just simply, after the assessment, and let me underline the word assessment, I assessed the patient and I realized her core wasn't activating. Now, what do I mean by core? Are these muscles, these invisible muscles that you actually can't see on Romeo right here, the core muscles or the intrinsic core muscles hold the spine in place to provide stability. When you injure your lumbar spine, your brain shuts off the feed to those muscles and you don't have the stability, and you start moving and your back starts giving away. So if you feel that your back is giving away, or you feel like it's going to give way, your core is not engaged, and you need to learn, or give me a DM over there, or any kind of Instagram. We have the same Instagram, Dr. Robert Silverman, email info@drrobertsilverman. And we will send you, or we'll do a video for you of how to facilitate your core. All I did for the young lady was I taught her how to facilitate a core, how to activate it with a 360-degree co-contraction, lasered that muscle, made it a little stronger, and guess what? Are we all right there? Because you look at Joanne's giving me that funny look.
No, we're just getting some hellos. You know.
Hi. Well, come on, tell me who to say hi to.
Hello from Netherlands.
Hello, Netherlands. Who else?
Thank you for the information.
You're welcome. I appreciate sharing the information with everybody.
Thank you for sharing. Thanks.
It's all about, you know, it's so funny. I was just working on a talk this morning, and I don't want to deviate from this too much. And we were going over it, and to be on the phone with another practitioner, and our enthusiasm Health has been the gift of life for me, and it helped me, and there's nothing better. I mean, this phone gets me 65,000 followers, and we're growing, and please like it, click, share it. So it's life-changing for me to share the information and learn from you. Getting back to where we were in the lower back, that woman, after 8 months of treatment previously, she now was able to contract her core and get her lower back much stronger. So it was she came back, I treated her on Saturday, she came in on Sunday, and she said, my lower back pain is gone. Now, we usually don't clear chiropractors or myself lower back pain in one treatment. However, that is a great choice. That's where you want to go. You want to seek a chiropractor out for lower back pain. How about headaches, neck pain? Absolutely. So what I like to tell everybody on Romeo, anybody that has a musculoskeletal spinal condition, if it's not broken and still attached, you need to see a chiropractor. And don't wait. Healing is a process. And within that process, people wait too long. So when you get injured, it's the best time to see a chiropractor. And the reason is the chiropractor can help you and aid you along the phases of healing, so you're not already into the healing phase and you're already into laying down scar tissue, everything's getting tight. You will get a better clinical outcome. In addition, everybody knows I do a lot of nutrition. So we do a lot of nutrition to aid in nutritional support. There's needed nutrients to help the body heal, to recover, to stay healthy. Because if we didn't need these nutrients, we wouldn't need to eat. So we're supplementing to diet. By the way, you need to change your diet. That's another thing chiropractors are really good at. We talk about a lot of what we call functional medicine in everyday use. What about lectins? What about gluten? What about dairy? What about this diet? What about that article about intermittent fasting yesterday, which was a article that was terrible? Yep, she's got me. Go ahead.
Matt Anderson asks, are chiropractors good for newborns, like if they have gas?
A great question, Matt. Yes, I don't do a lot of pediatric work. This is not my jam, as I like to say. There are chiropractors that specialize in that, and there are chiropractors that adjust babies that first second of their life. They're pediatric chiropractors. Some regular chiropractors do it. I happen not to. The answer is yes. You should have chiropractic care for your life. It's just like getting your teeth checked, except it's your whole body. Some of the other things are mid-back discomfort, that mid-back right in here, that hunching, the forward head posture. Everybody's chin is jutting from all the texting and looking at the phone like you guys are doing right now. Big thumbs up. Appreciate that. So any spinal complaint. Hip issues are also something. When people have hip pain, they're soon going to have lower back pain. They're going to hip pain. If you don't have the mobility in your hip and your hip doesn't move well in here, you'll have pelvis discomfort. How about women who are pregnant? If they've been treated before, they should continue to get treated. Post-pregnancy, yes, absolutely. They've just given birth. They usually have to get cut somewhere. They just lost a lot of weight. It was their child and all the amniotic fluid. Great, great choice. Chiropractors are great for athletic injuries, performance, and not only injuries and performance, but avoidance of injuries. So chiropractic care, every NFL team has at least one chiropractor. In 2016, the Olympics, the official medical director of the 2016 Summer Olympics was a chiropractor. In addition, chiropractic has been great for rotator cuff and shoulder injuries, impingement, rotator cuff. Again, some of the bigger takeaways, all the techniques that I mentioned before, but the assessment. Every patient comes in and gets assessed. And what I like to do, I like to spend an hour with the patient. We are now booking patients at an hour at a time. It's a special fee where they can come in and get an assessment. And that assessment's going to include nutrition, movement, and full body overall evaluations, inclusive of blood tests, because this way we can really see what's going on from the inside out. As my chiropractic vision is manual rehab and musculoskeletal health, matching nutritional biochemistry, put it together to funnel it down to overall good functional health. Carpal tunnel, very popular. Chiropractic has been shown to be very positive to help avoid carpal tunnel and treat carpal tunnel. We put the foot here. Ankle sprains, the most reoccurring sports injuries in America right now are an inversion ankle sprain. So without question, chiropractic works really well. Again, all those treatments. So I know Joanne held up the sign to see if she had some questions. Do we have any others, or should we just go to the ones that you're holding up over there?
So I do have one from Alicia.
Hello, Alicia.
She's asked, I think what she's trying to ask is when you have a disc replacement on your neck or your back.
Disc replacement?
Yeah.
Okay.
Is it still okay to see a chiropractor?
Absolutely. Again, so there are some contraindications to adjustment. So that disc replacement like you're talking about, or spinal fusion, you're not going to be able to adjust that area of the joint. There's other areas of the spine you can adjust. And again, with the laser, great takeaway, the soft tissue, the exercise rehab, the factor gives us a toolbox of quality tools to help your musculoskeletal needs, and when you incorporate the functional medicine, to help with your biochemical needs. I'm going down to IFM. We've got a practitioner health forum, and I'm going to be talking to all the executives on what the doctors need so we can mix and match with the patients, because a lot of what we do here is we ask a lot of patients, what do you need? Because we want to give you your needs. We want to help you. Any others, or should we just go to the list?
I think it's okay. Yeah, that's it for now.
Okay, so I can go to that one other list. They had asked, people always ask, what's the difference between a personal trainer, a physical therapist, an osteopath, an athletic trainer, and a chiropractor? So a personal trainer is someone that you would do exercises with. You have some great personal trainer friends. They're outstanding. Throw out Chris Guerrero from CrossFit. We got my friend Chris Collins. These guys are elite. They program. They're not just your typical personal trainer. They're really going to look at the whole body. They're going to give you exercise programs. Athletic trainers, that's somebody you usually see in a high school, professional and college rank, where they're helping people, and they're actually allowed to make diagnosis, and they're very valuable. Unfortunately, they get a little overworked. Physical therapist, well, there's always this thing, Yankee and Matt, physical therapist and chiropractor. It's not here with me. Physical therapist and chiropractor are different. We really specialized. Our inherent, what I learned in school was a lot of diagnosis, a lot of spinal adjustments. Since then, I've continued with the adjustment, always learned with the diagnosis, and I've added all the soft tissue and the laser and the nutrition and the like. And physical therapists are probably, each one is different. They're very well suited for post-surgical stroke intervention and things like that. I'm, with no disrespect to any PT, chiropractor, we're great at musculoskeletal. PTs are definitely great. I have a lot of referrals with and to from them for some different things. And osteopaths now were sort of the medical version of chiropractors, and they seem to have gone more the medical model in that they do learn how to adjust, but it's a different adjustment. And again, they're getting residencies. And of course, what do you go to the medical doctor for? Well, if you want a diagnosis of disease, you're looking for some medications. I have a lot of friends. They are anesthesiologists. They're orthopedists. Again, you always want to seek out and get a great referral from somebody to really seek out who you're going to let work with you. Just don't become a number in the system. Right now, so many doctors are stuck in what we call this ICD-10. It's a diagnosis code. And because of that, it's so driven towards that. We're very symptom driven. I'm all about systems. I'm not worried as much about your symptom. Your symptom's going to tell me what system is wrong. There's 12 to 14 systems in your body, depending on who you talk to, and that enables me, by evaluating systems, taking symptoms to evaluate symptoms, to get a personalized individual treatment plan for you, to allow you, through our collaboration, to get to root cause resolution and always keep you healthy. Do you have any other questions?
No, that's
Okay, guys, it's been my pleasure. Do me a favor, click, share it. Let's get those click, and shares up. Share what we're doing every Tuesday. We do a Facebook Live at 2. We try and throw some others in. I got a great Instagram going right now. I got Jacob killing it on Instagram. So it's Dr. Robert Silverman. Like my Instagram. We also have YouTube. Without any further ado, Dr. Rob, always yours in health.